Welcome to Medicine with the Metals. I'm Michelle. I'm so excited to have Christine Caldwell here today. We had her on previously, but it was a long time ago. So I'm excited to have you back and catch up. And you're doing some amazing work. I understand you're now in Oregon. So if you'll just introduce yourself and we'll just jump right into it.
Yeah, so great to see you and say hi to Mark for me. But so much has happened, I think, since we first talked, because that was quite a while ago. But I am the founder and executive director of the nonprofit End of Life Psychedelic Care. And we focus primarily on three pillars. That's education, both free events, online events, primarily focused on the public or geared for the public, anybody, and especially people with terminal or life-threatening illnesses. And then we have a series of professional educational courses. And our second pillar is connection. And what we do there is we bring the, say, consumers together in an online discussion group. We bring the professionals together in a members forum, and then we have a practitioners directory where we link the two together. And it's the first and only of its kind, where you have to be both an end of life professional as well as experienced in psychedelic care. And then
Okay.
I'll do advocacy. And right now, as you said, I'm in the state of Oregon. And so we're really interested in providing psilocybin services into the home. So starting to do some work along those lines. And at a federal level, looking at some legislation and some policy reform that, is potentially doable. I think also I do whatever it is I can to advance the field. And one of the things I'm so tickled about, I teamed up with a University of Chicago researcher, and we did a psychedelic death worker survey and set of interviews. And so we're in the process of looking at that now. But, we had 100 responses on the survey, and we actually interviewed 36 folks, like Bill Richards, for example, and several physicians, doulas, chaplains, therapists. So people who are really, really experienced in this field, and they shared their expertise. So that was a lot of fun as well.
I have so many questions. I have so many this absolutely fascinates me. So I want to come at this from every angle. What first got you into this? I mean, I know you had home health care before, you had a large agency. What brought you into this bringing psychedelics into end of life care?
Yeah, great question. Well, to even go back farther, very briefly, I was in Silicon Valley as a sort of marketing executive. And so I had this business background, and I wasn't sure how I was going to use it, but the home healthcare experience obviously taught me a lot about taking care of older adults, especially older adults who wanted to age in the home. And when I started to study psychedelics, it became a no-brainer, although quite frankly, I started studying with psychedelics today, their Vital Therapies and Integration program, and that was a
Mhm.
year-long program, and I didn't know what the heck I was gonna do, and literally, just about 2 months before we graduated, I went, "I got it. Oh my gosh, I'm gonna use my business background." Because I thought, at least at the time and right now, I'm not cut out to be a facilitator. I'm too like, gotta do this now. And every facilitator you've ever met, that's great. Is like, that's not me. So anyway, it just made sense, and it just really dropped in all of a sudden. And I knew there was an unmet need.
Mhm.
And sure enough, I launched it only in May of 2023, and it has definitely taken off.
So, and I agree. I mean, I felt the same way when I first, had my first plant medicine experience, and after that, knew that I was supposed to do something in here, but facilitating was not my thing either, right? So we have to bring to the table what we have. I
Yeah.
love that you brought your business sense to this, and because at the end of the day, while we are in a spiritual field, if you want to say, it still is a 3D business.
Which is why, if I could put a plug in for the Psychedelics Today Vital program, I chose them because I felt it was really comprehensive, and they understood that the psychedelic field needed an ecosystem. So they needed folks like us, to help the facilitators and help bring the facilitators to the clients. So yeah, it was a perfect fit for me.
Do you find that people are searching for this? I know that Dose 2 just came out last year, I believe. I watched it, of course. It was, amazing to follow this. Do you feel that people are really reaching out? Are they how are people finding you?
Yeah, so you said something, about this being a spiritual experience, basically. And so it's interesting. On one hand, I'll say not enough people know about this, but when they find out about it, and I will say from a trusted source, then they're so interested in learning more and they're so interested typically in moving forward. So I have to say it's been a challenge, and I think it's a challenge for anybody who is working on both the consumer as well as the professional side. But what ends up happening is on the professional side, it's kind of easy to find. I mean, I started with a good base of a professional list and word of mouth, it's grown. And of course I do a lot. I mean, I've done a lot of workshops, and I'm always up for doing a free workshop for any community group. So if anybody's listening as well, I'm happy to do that. But on the consumer side, yeah, it's slower going, but what I do know and what I always think about is the fact that, say, in Canada, you have TheraSil, if your audience is familiar with that. So, they're a nonprofit as well, and they provided the training for end of life psychedelic care, but they really have spearheaded a lot of the work being done through Health Canada to deliver psilocybin services. And so they have a phenomenal wait list for people interested in getting approved through Health Canada. So again, once we know that there is this trusted source talking to people about it, then they kind of flock to it. Right now, what we see is that whether you're an end of life doula or a therapist or a physician, then or chaplain, then it's your clients that if they are receptive, if they ask about it, then those are that's how we're finding the client side.
Let's talk about the psychedelic side of this and why it works or has the potential to alleviate the anxiety that must come. I can't even imagine. Um, let's talk about why psychedelics help with that. What does it do?
Yeah, so there's a lot of reasons, just like anybody else might choose a psychedelic, their intentions might be different. But what we know, when you're faced with a terminal illness or even a life-threatening illness, a lot happens to you. First of all, you feel a loss of control. And yes, that death anxiety or fear of death and dying comes up, and it's debilitating. It can be debilitating, which then can also lead to depression. But there's so much more that's going on. Individuals may be feeling guilt over something they did to somebody that there hasn't been forgiveness, or they feel guilty about something that they did, or their family dynamics are in disarray and could use repair before someone dies, or there's something else that they want closure on. But think about it, they're faced with losing everything you hold near and dear. So whether that's your loved ones, really important, whether that's your pets, but it's everything. It's all your material stuff, and again, it's losing control of your life. And what we know is psychedelics can help with all of that. Not for everybody, we know that, of course, but for a lot of folks, where it helps is tremendous. So, but when we talk about fear of death and dying, that extends to a lot of different sort of, I guess, tangential aspects of that. And by that, I mean, um, we may want to experience consciousness. We may want to at least know that there's something beyond our physical bodies. We may even want to get a glimpse of the other side. And we certainly want to feel comfortable in our death and dying. And then the other thing along with that is with whatever days we have remaining, we want to live a life of purpose. So again, if I look at what psychedelics can do, and I frequently talk about 4 different ones, and if you don't mind, I'll describe that.
Please. Mhm.
Because, you know, of course, this is a generalization, but they do different things with a lot of overlap, of course. But if we look at something like MDMA, first of all, we say MDMA is probably not a great medicine when you're closer to the end of life because of the impact on one's heart or one's blood pressure. However, think about that when it's a heart opener and it helps you with self-compassion and other compassion. So it's exactly what I was talking about, where if you harbor some guilt that you want to help get rid of, or if you want to repair or deepen a relationship, a loved one's relationship, then MDMA is so great. And of course, we know that there's an ongoing study at Sunstorm Therapies, a research facility in Rockville, Maryland, who is working with MDMA and couples. So one of the couples has a cancer diagnosis, and the other individual can be their spouse, their significant other, their adult child, and they're going through the exact same protocol. That research hasn't been published yet, but there's some really great stuff coming out from their work. And then, so if we go into yeah, and well, anyway, that's MDMA. So let me go to psilocybin. So psilocybin, we feel, is a really embodied medicine, and it brings issues front and center. So a lot of times when you talk to folks, whether it's the people who've gone through the research or it's people in the real world, then they speak in terms of talking to their cancer, confronting their cancer, working with their cancer. There is a beautiful story told by Thomas Hartle, who was actually the first Canadian approved for psilocybin therapy through Health Canada. And he had that exact conversation with his cancer, and his cancer said
Mm.
to him, "Do you think I want to be here? I don't want to be here." And he came to understand that his cancer was as much as consciousness as everything else. And this man did. He had 7 psilocybin journeys over the course of about 4 years. And he really, he's an example of almost a Maslow's hierarchy, where he started psilocybin to relieve debilitating anxiety. And it really helped with that. But I also want to point out, one and done did not work for him. He said after about 3 months, he felt he needed psilocybin again, but he was very fortunate to have 7 treatments approved. But in any case, and then he
Oh,
moved to dealing with his fear of death and um, coming to grips with that, but then also expanding his consciousness. And I think it's panpsychism, right? Where he believes that everything has a consciousness, and that's what he got to with psychedelics. So he lost his fear of death and dying entirely. So that's psilocybin, and embodying it too gives you an ability to bring it back. You know, because we're all, I mean, we can say, "Oh yeah, it relieved my anxiety," but it doesn't relieve your anxiety forever. It's quite possible to bring that back into your body and to feel really good about that and bringing back that experience from the psilocybin journey. So now let's talk about ketamine. Ketamine, as we all know, is entirely different in the sense that it's a dissociative anesthetic. And what it does is, in separating, or the feeling of separating your mind from your body, is it's more of an observer effect. So it's more in your head, where you get a sense that, I exist outside of my body. And when they did a study, and I think there's some 5,000 participants who reported on their near-death experiences, and they mapped that to psychedelics, and they found that ketamine actually was the most like a near-death experience. And certainly a lot of people talk about that, where they talk about, yes, I was on the other side. Yes, I talked to my loved ones. There's a woman with end-stage cancer who routinely participates in ketamine sessions, and she sets her intention to talk with her loved ones on the other side, and she does. So, ketamine, yeah, very different. And, I also want to mention as I say all this that one type of psychedelic, may not be sufficient either. I mean, we know of many, many, many people in the field who work with multiple medicines, whether it's in the same session or in different sessions for the different reasons. And then I also talk about 5-MeO DMT in very, very, very low doses because, as your audience would know, I mean, that brings you face to face with, unity consciousness. You are one with the universe. And in very low doses, it can really be helpful to somebody closer to the end of life. And when I say low, I mean 5 milligrams. And you can always then add another session because, of course, the sessions are short. And if the facilitator and the client decides, yeah, I'm ready to do it again, I didn't quite achieve what I had hoped to achieve, then another 5 milligrams is great. And I think too, as I'm thinking about that, because the question always comes up about dosing and the psychedelic medicines, and it is, the famous phrase is start low, go slow, and you go, what the heck does that mean? But for psilocybin, depending on the client's experience with psychedelics or the frailty of their physical body, then you could look at 1.5 grams to start.
Okay.
You could look at adding another 1.5 grams, an hour in or so. And if you're going to work with somebody really close to the end of life, you might start with 0.5 gram of dried mushrooms. Um, with MDMA, what I hear from the people who work with MDMA, a lot of times they'll start with 80 milligrams and then a booster of half of 40 milligrams. Ketamine, it's all over the map. A standard dose has been known to be 5 milligrams per kilogram, but that's not sufficient for a lot of people for therapeutic benefit. But I know a physician that routinely uses zero point 0.7, zero point 0.8 milligrams per kilogram for individuals that are actually quite close to the end of life with no ill effect. And he even does a booster of, I don't know, 15, 20, 25 milligrams, um, like about 40, no, about 15 minutes in because he's doing intramuscular. So anyway, it's really interesting to when we talk about the dosing. And I had always talked about, if you had a choice between LSD and psilocybin, choose psilocybin because the journey is shorter. And then in this series, I had mentioned that I got to do this really great psychedelic death worker survey. So one of the end of life doulas works with LSD, but 50 micrograms. So she works very, very, very low. And so the journeys obviously are not as long. And if it's sufficient to do what the client intended to do, then have at it. I would say, please don't do ibogaine. I would also say, please don't do ayahuasca. If for no other reason than so many people toward the end of life have medications that may be contraindicated for ayahuasca and need to be taken. And those journeys, as you know, are really rough on the body and very long.
Here's the thing with psilocybin. I always call psilocybin the great connector, right? It connects us to ourself, it connects us to source, whatever that looks like for you. It connects us to all other beings on earth as well as Mother Earth herself. It is the great connector. I can see how this would be incredibly helpful for anxiety and depression, and connection. Ayahuasca, I get it. There's so many medications that I imagine people are on, they can't go to it. But a DMT experience, and tell me your thoughts on this, I would think is the closest thing to a death experience that there is. I think. I don't know, I haven't died yet, but I've had quite a few DMT experiences, or just psychedelic experiences, but DMT in particular. And I get emotional about this. It's you can have these experiences and see the other side, as you say. Do you think that is primarily what people are coming to see for fear of what is on that? Because myself, who have done so many medicines and sat in ceremonies and sit with our tribe regularly, and I still have a fear of death. Mhm.
Yeah, yeah, and let me reframe that just a little bit because you said something that reminded me too, connection to nature, and so you know, just about everybody that works in this field for any length of time understands that it's basically a spiritual model. It's not a medical model. So even though we talked up front about the ability to reduce anxiety, ultimately people are looking for that spiritual experience. And it doesn't matter if they're an atheist, because I think, they may find the connection with nature to be what really helps them understand that there's something beyond our physical beings. And yes, to, like I say, get a sense of what is on the other side or what this next phase might look like. And I do think psychedelics can do that. That it's not true for everybody, or it's not true, maybe up front somebody's intention is to deal with their mental health or existential distress in general. But I think any of them with an opportunity to continue and to do multiple types of journeys, again, with the different types of medicines, really can help them get to that place that you're talking about. But the idea of the spiritual model, I think, is really important in terms of how it informs how how we help people journey and how we help people integrate after the medicine sessions. Because if it's strictly looked at as a psychological or medical model, then I think we as facilitators sometimes can miss the point. And so it was fascinating again because I'd have this great experience of talking to so many different types of facilitators and practitioners that the physicians all understand the spiritual model. So you think that maybe they would come at it from a medical standpoint. Certainly that was their training, their background, but they all understand it's spiritual.
Well, I think when it gets to that point that it really is the end of life, I mean, their job is now just to keep comfortable.
Yes, except many of the physicians, of course, we live in a psychedelic bubble, right? So the physicians, or therapists or nurses that I get to meet, have shifted their belief systems around it's more than just making people feel comfortable, because that's clearly it's not just helping people feel comfortable. I mean, the medical establishment does their best to keep people alive when in fact, that may be to the detriment quite often to that individual and their quality of life. So, yeah, the physicians who get it have shifted to understanding that we need to help our patients live the best life they can and to have the kind of death that they want beyond just going out on increasing doses of morphine.
Well, I think Western medicine in general is making that shift. Of course, I do live in that psychedelic bubble, but
Right.
I
We do.
feel it. I talk to people every day who are going to their doctors and asking to titrate off of their medications because, they wanna go to plant medicines and they wanna do something more
Yeah.
natural, and it's there's definitely a shift.
Yeah, I agree. And a lot of us kind of have this sense of urgency that we go, well, we want everybody to understand this. We want to change these, you know, institutions that have been ongoing for, decades, at least in terms of modern medicine and how we attempt to keep people alive. So you're absolutely right. Just, in the work that you guys are doing, and I saw the number of followers. I mean, it's extraordinary. The reach that the plant medicine path has, And that is a testament to what you just said, and certainly from my standpoint as well, because when I said that the nonprofit took off, I mean it took off. Last session I did, excuse me, there were 500 registrations. I mean, I'm blown away by the interest in this. I was just in Boston and I gave a talk to the Aging Life Care Association, at their annual conference, and the room was packed. And it was like they're all wanting to learn about psychedelics and how it can help their clients. So I was so tickled to know, all right, so they'll have this in their back pocket, to be able to talk to their clients about, and to, recommend that their clients reach out to end of life psychedelic care to learn more. So you're absolutely correct. And I think part of that movement goes back to the fact that we've seen this, the spiritual movement, because we talk a lot about, oh, religion is dying. We know that a lot, in a lot of cases, participation in regular religions um, uh, is on a decline, but the spiritual side is really, really growing. So that really opens up people's receptivity to the use of plant medicines, clearly.
It does. We've had 2, Western physicians who have been on the podcast, who both actually left. The one lady, she's a physician in Colorado, and she had gone and done ayahuasca for the first time after being on the front lines of COVID, and was traumatized herself, so went to go do ayahuasca for that, and then, 8 years later now has given up her license in Western medicine, and opened up a psilocybin and ketamine. So, and then we had another lady as well. So it's there is definitely a shift going on, and I think that a lot of the shift in just clients or people is getting that education and information out there, right? It's breaking that stigma and helping people to realize that they rethink what you thought, rethink what you know. That's what I always put on all the posts. Rethink what you know, because it's not what you think. It's not what we were taught.
Exactly. And education is the first step, always the first step, but it's not sufficient, which is why I launched the practitioners directory and the online discussion group. But beyond that, what I want to really get involved with is, I'm not going to deliver services. I'm not going to deliver medicine. But to really kind of foster the environment, or to build the partnerships to advance this much more quickly, because a lot of times you'll hear, oh, we don't have trained people. I hear that all the time. It's like, we know a lot. I mean, this is in part why the researcher colleague and I did this psychedelic death worker project. We know a lot, and we need to leverage that knowledge, and bring it. Like, for example, in Oregon and Colorado, and maybe somewhere down the road in New Mexico, we can provide um, services for people toward the end of life based on what we already know. So what, let's go. There's an organization called Survivorship Collective, that is doing a series of pilot retreats in Portland for their cancer thrivers or cancer survivors. So quite excited about that. But we need more of that. We definitely need more of that. We know that we can deliver ketamine in the home, and I love the work that I did with this palliative care physician in Northern California, who's the one I referred to earlier, that does intramuscular at pretty significant doses. And we need to pilot that model on a more broad basis, and then replicate that model across the country. There's no reason why we can't do that now. Well, we need funding, but you know, getting the funding would allow us to take that model that he and I built, and to replicate it now.
Are you finding that it is easier for people to reach out in states like Oregon, Colorado, and New Mexico than in some of the more conservative states? Or people don't care?
Yeah. If I'm looking at the sheer numbers, and you know, I don't keep a count on this exactly, but if I'm looking at the numbers clearly, California big on clients wanting to use the medicine, and New York, but then yeah, I mean there's always requests coming in from individuals who are really looking for support, and maybe even, you know, as you say that, you remind me, when they're in a more conservative location, then they don't know where to turn. A lot of times in California, you know, they somebody knows somebody. And I always also say, find your closest psychedelic society. And you know, they actually exist in a lot of places, but there's going to be other places where they don't exist. But then we also have the potential for ketamine, where I'd like more people to know about how it can help people toward the end of life have a more peaceful death. Certainly the examples from this same physician, you know, are really, really heartwarming. There was an ALS patient, advanced ALS, who, as it turned out, it wasn't planned. He was within 2 to 3 weeks of passing, and the ketamine just brought him great peace. I mean, great peace. He felt like the shackles of his physical body that had failed him, you know, he was free of that, and he could, you know, he could face death calmly then. So yeah, that it could help, especially for folks who aren't willing to work underground, you know, or in deep decriminalized areas. Certainly, yeah. So I mean, in decriminalization or decriminalized jurisdiction, I mean, like in Michigan, for example, or out in the DC area, you know, there's a lot of folks asking for it because there's a lot of folks then that are delivering the services.
Do you find that people mostly are concerned with the legalities when they come to you and they're in more conservative states or not decriminalized areas? Or at this point, are they just they're ready to do this and that's not a concern? Because people that come to microdosing, that's going to be one of their first concerns is the legalities of it. But at the end of the day, they want to understand this medicine and they just want to do it. They wanna
Well,
understand it.
that's a good question. It's certainly not something we ask, because if we feel if they're reaching out, then they've gotten over that hurdle. But I would say, yeah, we have this conversation all the time. You know, th- we're dying. I'm dying. We get that terminal diagnosis. It's like, don't you dare stop me from doing something that I feel I need to do. What are you going to do? Put me in jail? So yeah, whatever. So I do think they have crossed that hurdle, that they understand, they've heard enough about it that they really want to move forward. And then the big thing becomes, and of course in my work specifically, it's like, please, 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 please use a trained facilitator. Don't do this on your own. And now, you know, I say that, but you know, there's psychonauts out there that are getting closer to the end of life. And certainly when they know the medicine as well as they know and they want to do it on their own, fine, you know, not an issue. Maybe somebody close by you can call, but you know, that's not an issue. But for most people coming into this fairly new, I mean, you know, there's also a lot of folks who are older that did this when they were younger and it was strictly recreational. So they had that base of knowledge, but when they're older, they maybe want to get a medical clearance. That's another big thing that we talk about. So it's wanting to feel safe. So having that maybe clearance from a physician, and there are physicians that will do these medical consultations, or we all know Ben Malcolm, the spirit pharmacist, and there's other ones coming online that are doing this work. Kristen Spear comes to mind. So you know, it's really important, but I think that's the thing they worry about most. the safety. And another end of life doula told me a great story. She said, because I did ask her a kind of similar question, and she says, yeah, people who are maybe earlier in their diagnosis, they'll have that anxiety about the journey, in addition to having anxiety about their diagnosis. But she says when they're a lot closer to the end of life, it's like, bring it on. I want to feel that. I want, what we've been talking about. I want to feel what it's like to die and be on the other side.
Well, 5-MeO, I mean, Bufo, it's the God molecule. It's a big one. I mean, they're all big ones, right? Life is medicine. Life is
Y-
a big one. I mean, it's
You,
it's it's so funny when people
I-
say this, but it really
yeah.
is the it is the medicine for myself at least that showed me that, but then how quickly it left as well. I mean, it came and it left. And so I can see how 5-MeO would be an incredible medicine
Right.
in
in
smaller
in
doses,
that.
although I don't know what a small dose is that they give. I missed that, I apologize, what you said the normal doses for 5-MeO.
Yeah, well, thanks for bringing that back up because I want to clarify. Everybody that I talked to, and we just had Joelle Briere do a course for us, a workshop for us, and we're talking about the alkaloid because of the number of toxins in the bufo toad itself that we don't want to go there. Not for people who are frailer, and especially as if we've been talking about closer to the end of life. So that was 5 milligrams is what I was talking about. Yeah. And going through the arc of the journey and then touching base with the client and making a decision whether you're going to do it again or not.
Yeah, I mean, it's a lot, it's a big integration of that medicine.
Yeah. But he also reminded me something else when he said life is medicine. I love that because we also talk about two related concepts. Um, all psychedelics are death work because it's helping you come to terms with death regardless of when you do it, and all death work is psychedelic because we also talk about the fact that as you get closer to the end of life, the veil thins as your body becomes frailer. That veil thins, and I use the word ethereal, whether that's a good word or not, I don't know, but we become more ethereal, more in touch with the spirit world. And so sometimes you don't need psychedelics. Sometimes, because again, our goal is not to use psychedelics. Our goal is to help somebody have a good death and to overcome their fear and even look forward to, this next phase, this next journey. So, there are other things that can help, any of the contemplative traditions, yoga if the person's able to do it, Reiki is a clear sort of integrative practice. Some forms of massage. So we definitely want to help that person have a good death. And psychedelics just becomes one tool for that.
And what does that mean, a good death? What does that mean? And I imagine it's individualized for everybody, but for in general, what does that mean?
Well, I would throw the question back to you. I mean, like you say, it's individual. So you answer it first, then I'll answer it.
Okay, I would think a good death would be without fear. Right, fearless. I don't know if that's possible, but without the fear. I think that is for myself what does hold me back. It's that fear. It's not the unknowing of what's on the other side. I've seen that. So I don't know what that wall of fear is.
Yeah, exactly. So I think that that's a biggie. And I think though too for a lot of people it's the fear of pain. Um, so the fear of the unknown, fear of what does it feel to actually truly separate from your body, and the fear of pain. And so psychedelics isn't necessarily going to take care of all of that. There was Omar Thomas uh, from the Diaspora Psychedelic Society in Jamaica said something once. There are necessary and unnecessary discomforts in in the human condition. Is how he meant it. And psychedelics don't necessarily take away the necessary discomforts. So, it's a matter of though coming to terms with them, whatever that might mean. But I'm also hopeful that psychedelics, ketamine for sure, reduces pain. In fact, it's used a lot. There the Another client story was that his end stage cancer had led to excruciating pain that his opioids were not touching. Pain level of 9 to 10 every single day of his life. So can you imagine? I mean, he had medical aid. He had medical aid and dying approved because this was not any way he wanted to live, and you can understand that. Well, when he got the ketamine therapy, yeah, that pain was reduced to 2 to 3. So it worked unlike any other medicine. And now we see that there's research and certainly there's anecdotal stories about psilocybin relieving pain as well. Maybe not as well as ketamine because ketamine is its mechanism of action is well suited to doing that. So there's a lot of hope there too. But yeah, it's the fear, it's the fear of separation of mind body, the fear of the unknown, and I think the fear of pain. In fact, you were talking about 5-MeO, another story. Hope you don't mind all the stories. I get I got a million stories. So this is a 5-MeO story, and the client was given 5 milligrams, and as she do it, this is how it was explained to me, so I'm going to do it this way. This woman was afraid, not of dying, but she thought that separation of her mind from her body was going to be painful. And so when she's in this journey, she's going like this: separate, separate, separate. And she kept repeating it. So when she came back, which was luckily only about 15 minutes later, um, the facilitator asked her, well, what was that all about? She says, yeah, my mind was separating from my body. And she says, well, and how was that for you? Was there any pain? She says, no. She goes, there you have it. There was no pain associated with it. So she was good. She was good to go. I mean, so so many different things happen for these individuals, um, that you just never know how it's going to help them.
Let's talk about the families for a minute. How do you incorporate the families into this process?
Oh yeah. Let's start with informed consent because there's so many aspects of the process that has to be modified to the needs of your clients when you're working with people toward the end of life. And one of them is informed consent. And so it's has to include the family, at least in understand the facilitator has to understand what the family's beliefs are around psychedelics. And yeah, you can be working with clients that are totally estranged or don't have family members, but they typically have loved ones. Also, by the way, healthcare surrogates that can cause problems if they decide that they don't want their loved one or client to be using psychedelics. So, family members, yes, number one, they need as much education as the client does. So we talk about there's any number of ways for the family to participate. So, but education have to. They can participate in the preparation. They can participate in the integration. They can also journey with, or they can journey separate and then they can integrate with. So a lot of it is, okay, let's understand your family dynamics. Let's understand what your intentions are. Sometimes if the family dynamics are like this, there was a daughter and a mother who were like this, and they decided, no, we're not going to do a journey together. We're going to do our separate journeys, and then we're going to come and we're going to talk about it. And that worked really, really well. The other thing I would love to see, I've been trying to talk to some people here in Oregon, haven't quite got it off the ground yet, is group microdosing. So if you can get family members or groups, really cool thing, of course, is getting people together who have a similar diagnosis, or at least they're all faced with a terminal illness, and to microdose and to facilitate a deeper, more vulnerable, more compassionate discussion around what's going on. So yeah, in any number of ways that the family should participate.
I love the family microdosing together and going in to figure some things out together.
Yeah, thank you. So planting seeds out there for anybody who's listening, I think this would be totally cool.
Yeah, no, it's an amazing thing. We love when we find that families, maybe the son will start and then the daughter will start and then the mom will start and it's just really an incredible thing when the whole family participates. Do you
Yeah,
find a
yeah,
lot of
and
resistance from the other family members sometimes?
let me say something first, but don't let me forget that question. Um, the other thing too about microdosing um, is for grief. So, and there's no time like the present time, you don't have to wait until your loved one passes to start like dealing with the grief of losing somebody. But then clearly after that, so that's the other thing I'd like to see are microdosing groups for grief. Okay. So, oh, you,
So important. You got my mind reeling now
yeah,
about helping start something like this.
yeah, good.
I would say my question was about the resistance of family
Oh,
members, or are they generally just supportive and they just want to help support?
yeah. Okay. So again, it's not something that I have tracked when I talked to people. I ask the question, but I don't ask the question of everybody. So there's somebody invariably has a story, but I certainly get the impression that for the most part, family members are supportive, and probably for the same reason that we said earlier. This person is dying. Um, if they feel that this is going to make them more comfortable, yeah, let's do it. And which also reminds me, I mean, the going back to that physician, and I highlight this person because there are health conditions, or at least the advanced stage of some of these health conditions, where I think having a physician on board is really important. And he was very blunt with not just the client, but this client's son. And it was like, you could die. And it was like, yep, we got it. You know, I was gonna die anyway. So yeah, yeah, and it's tangential, but it just reminds me of so many people are pragmatic. So many people who work in the field, and this is another aspect of what I'd like to highlight, is that I think it's really important when you're working with people toward the end of life to be either in collaboration with or have your own experience in working, with end of life, whether you're a doula or chaplain, like say hospice nurse, hospice physician, hospice social worker, or to get that experience. It's always a really good thing. Um, but uh, I don't know where I was going with that. But yeah, to work with somebody who's got that expertise, I think is really good.
Yeah, I'm sure that that's important, putting all these pieces together for the family.
Yeah,
To
yeah.
have the best experience. Well, incredible work that you're doing. Before we wrap this up, and we definitely want to have you back. I really love what you're doing out there and really all over. What do you find is the biggest? And I've been on this 30-day dieta, so I'm not. It's not what do you find as a challenge, but as an opportunity. I'm not allowed to use the word challenge. It's an opportunity. What do you find is your biggest opportunity right now, moving forward?
To get these services delivered, and you start with what you have and you go from there. when I mentioned Health Canada and their psilocybin approval program, it's a special access protocol program. Um, the Roots to Thrive is this great outfit in British Columbia that developed a group therapy model. I mean, group for some people is just perfect and cost effective. They've been doing it successfully for a few years now. Let's replicate their model, and we can replicate that model in Oregon and Colorado and potentially in New Mexico. New Mexico, of course, as you know, is more of a medical model. But in any case, yeah, let's use what we know and get going on it. Let's take this body of knowledge from the underground. It was really interesting when we did our survey. We found that the highest percentage of individuals had both underground and above ground experience. So there is a body of knowledge there that can bring this safely forward. In the ketamine world, tons of hospice physicians, ER physicians, anesthesiologists who understand ketamine. We already know. I mean, people get caught up. I don't know what the protocol is. You're practicing the art of medicine in the case of ketamine. It's like you're it's doubtful you're gonna kill the patient. I shouldn't say it that way, because these medicines are so safe. That's the other big thing. These medicines are safe. And that's what really bothers me about the inertia sometimes at the federal or state level, any governmental body. These medicines are so safe. What are you afraid of? They're safer than anything that gets approved out of FDA, which is why most of us are really aggravated and mad about the MDMA approval. That benefit risk, yeah, risk reward, who did that analysis? It's like clearly the benefits far outweighed some of the risks that were brought up, which were arguable anyway. So sorry for that soapbox, but yeah, let's get going. That's the opportunity. Lots of things to figure out. Be great to like get the reimbursement model done. But you also need the collaborative model, like say on a community basis, which is why I want to replicate some pilots. How do you work with your local hospice agency or your local palliative care agency? How do you work with the oncology centers, to be helping each other out and for them to see that this is a win-win for them and for their client?
Hmm. Absolutely amazing. Have you seen the Dose 2? Have you seen the documentary?
I have not. I think about all the things I have not yet read. Hey, I just finished the psychedelic experience, based on the Tibetan Book of the Dead. That was a trip. That was a trip to listen to. Yeah, I try to listen to as much as I can. And Bill Richards' book, Sacred Knowledge, I also just listened to. So yeah, it's nonstop, like you guys. It's always something to learn, right? And always, I loved how you phrase that. There's always an opportunity. Always, 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 always. And I hate not hate, you know, when people say, "Oh, yeah, but this isn't happening, that's not happening." It's like, "Yeah, then do it." Just 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 do it. Just and start with where you're at, and let's just get yeah. Anyway,
Well, I appreciate you coming. Before we wrap this up, if you let everybody know where we can find you, how we can find you. You're in Oregon, but you're all over.
yeah, so, again, the nonprofit is yeah, right, yeah. The, nonprofit is End of Life Psychedelic Care, so the website is EOLPC.org. You can email me at Christine@EOLPC.org.
Okay, we will definitely put that all over the plant medicine path as well, and we would like to continue this discussion. It's an important one. Well, thank you so much for coming on and talking with me today. I'm sorry that Mark couldn't be here, but that's Costa Rica. But this is an important discussion. It's an important conversation. We're all going to die. We're all going to
Yep.
die. I mean,
That's
when I
yep.
kind of giggle when I hear you say, well, when people say, well, I'm dying, We are, but when it comes at a fast pace like that, you're doing very important work.
Well, no, and I appreciate you allowing me to come and talk about it because obviously it's something that I talk about every single day, and I just love for more people to learn. And I would encourage anybody who wants to get involved or wants to learn more to yeah, check out my website or get in touch with me because the more people that can help move this forward, the faster we can do it. And I'm so pleased for your success, you and Mark's success, and I wish you continued success and happiness in Costa Rica.
Well, thank you. We're just trying to continue to educate, get out the education, information, and integration. It's important.
Yep, cool.
All right. Thank you so much.